Experiencing a cough after surgery can be common, especially as your body recovers and airways clear. But what if you notice something unexpected, like a hint of blood in your mucus? It is natural to feel a bit concerned when new or unusual symptoms appear during your recovery period. This particular symptom can certainly raise questions and often warrants careful consideration. Yes, a cough with bloody mucus after surgery can indeed be serious and always warrants immediate medical attention. While not every instance points to a life-threatening condition, it is a significant warning sign that your healthcare provider needs to evaluate right away. Do not try to diagnose yourself or wait to see if it improves on its own. The reason this symptom is taken so seriously is because it can indicate a few critical post-surgical complications. One of the primary concerns is a pulmonary embolism, which is a blood clot that has traveled to the lungs. Surgery, prolonged immobility, and certain medical conditions can increase the risk of blood clot formation. Other possibilities include pneumonia, a lung infection, or even irritation of the airways from coughing itself that has led to a small amount of bleeding. Your medical team will want to rule out the most serious causes first. If you experience a cough with bloody mucus, your most important step is to contact your healthcare provider or surgical team without delay. Be prepared to describe your symptoms clearly, including when they started, how much blood you are seeing, and any other symptoms like shortness of breath, chest pain, or increased fatigue. They will guide you on the next steps, which may include coming in for an examination or further testing. Avoiding self-treatment or postponing this call is crucial for your safety. Understanding the nuances of postoperative recovery means knowing which symptoms are routine and which requiring immediate professional input. While deep breathing and coughing exercises are often encouraged to prevent issues like atelectasis or pneumonia, the presence of blood changes the dynamic entirely. Your medical team is trained to distinguish between minor irritations and serious complications, and they have specific protocols to investigate and address symptoms like bloody mucus to ensure your safety. Being proactive about any concerning symptoms is a key part of a successful recovery journey. By promptly reporting a cough with bloody mucus, you are ensuring that any potential complications are identified and managed quickly. This commitment to transparent communication with your medical team helps safeguard your health, provides peace of mind, and supports your body's healing process effectively.